Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers. Now, your host, Warren Zysman.
Good morning and welcome to Healthcare Sunday. I want to welcome all our listeners on 104.7 KJUL, the jewel of our valley. Healthcare Sunday is sponsored by TrueCare Treatment Centers. If you or a loved one need help with alcohol, drug addiction, or mental illness, call our 24/7 hotline for TrueCare Treatment Center, 1-833-203-2848. The 24/7 hotline is 1-833-203-2848. I'm your host, Warren Zysman. For our new listeners, I'm a psychotherapist with expertise in treating addiction, mental illness, and family problems. I'm really excited to be joined by our guests who are both heroes and leaders of our community. They've served our community as public servants for many, many years in the city of Henderson. We're joined today by our fire chief, Sean White, and our deputy fire chief of support for the city of Henderson, Scott Vivier. Chief Sean White was selected as the 11th City of Henderson Fire Chief in September 2017. He started with the city in July 1999 as a firefighter, paramedic, advancing to captain, platoon chief, deputy chief. Committed to providing exceptional emergency response and mitigation, Chief White has provided central leadership in the development of outstanding operational systems and curriculum for the Henderson Fire Department. These programs have influenced many other departments in the region. Respected as committed expert to the mission of fire service, Chief White remains focused on protecting the lives and relationships of the citizens of Henderson. While Sean served as deputy chief, the City of Henderson Fire Department became the first triple accredited fire department in the country. Henderson Fire maintains accreditation through the Commission on Fire Accreditation, the Commission of Ambulance Services, and Emergency Management Accreditation. Chief White began his service career in 1989 for the Albuquerque Fire Department. He advanced through the ranks from firefighter, paramedic, to engineer, to lieutenant. He worked for Albuquerque Fire Department for 10 years prior to joining the Henderson Fire Department in 1999. Sean and his wife Kim have been married for 31 years and raised 3 daughters in the community. They enjoy time off with their 4 grandchildren. Chief White also holds a bachelor's degree in fire science. We're also joined by Scott A. Vivier. He is the Deputy Fire Chief for support for the City of Henderson Fire Department located in Henderson, Nevada. Chief Vivier began his career as an EMT with Mercy Ambulance Company in Las Vegas while attending the College of Southern Nevada, where he obtained an associate's degree of general studies and an associate's degree in paramedic medicine. Chief Vivier graduated from Utah Valley University with a bachelor's degree of science and emergency services administration. Is currently completing his final year of law school at UNLV William S. Boyd School of Law. Professionally, Chief Vivier has served the City of Henderson Fire Department for the past 19 years. He's held ranks of firefighter, paramedic, medical services officer, division chief of EMS, and deputy fire chief. In addition to serving on the fire department, Chief Vivier has taught for 5 years at the College of Southern Nevada, an accredited university, has served as an accreditation reviewer for the Commission on Accreditation of Ambulance Services, and he currently serves on Trauma Intervention Program Advisory Board for Las Vegas, where he's also an active TIP volunteer. I want to welcome you both to the show. Chief White, we're very, very excited to have you here, as well as you two, Deputy Chief Vivier. One of the things that we wanted to maybe talk about today is some of the listeners over the last couple of weeks, they've reached out and they heard that you guys are going to be on the show, and they said, hey, I've always wondered if I could become a firefighter. I just don't even know if I could even apply, what the process would be. And I'm hoping maybe we could start off the show by letting the folks in the community know what the process would be for applying and what the eligibility requirements would be to become a firefighter.
Yes, absolutely. First of all, thank you, Warren. Really appreciate you having Scott and I here today to talk to you about the Henderson Fire Department. Whenever we get an opportunity to brag about our organization, we jump at it. So thanks for giving us an opportunity. Yes, we are currently in a recruitment process for developing and hiring list for hopefully the next 2 cadet academies. As you know, we are going through explosive growth in Henderson again. We're very excited about that. And as I tell my staff constantly, it's something we're very excited about and terrified at the same time, because we're going to need a lot of new employees and make sure we get the right employees. So Currently, we are recruiting for the rank of firefighter for a cadet class that will be starting in September. We'll also be hiring for a class that will be starting next January. That recruitment is currently open. It closes April the 1st. So if you are interested and qualified, please, all you need to do is go to joinhendersonfire.com. All the information you need to sign up and apply is on the website. A lot of information you'll need to actually prepare for the process and the test is also there. Really simple as far as qualifications. You have to be at least 18 years old. You have to have a driver's license, and you have to have an EMT license.
Fantastic. And for folks who do get selected, what does the training look like? How long does the training take place?
Yeah. So the Fire Academy process, we really wanted it to be something that's accessible to everyone in the community. So like Chief White said, if you have your EMT and you're 18 and you got a good driving record, but more importantly, you care about people, we're going to teach you the rest. And you learn that in an 18 to a 20-week Fire Academy. And in that Fire Academy, you're going to learn everything you need to know to become a Nevada State Qualified Firefighter 2, as well as a Southern Nevada Health District Certified EMT. And so in that academy process, which again is 18 to 20 weeks, it's 4 days a week, it's physically, mentally, spiritually tough, but we want to make sure you're ready to do it. After you get out of that academy, you'll then be on probation for the remainder of a year period where you'll take what you learned on the fire ground and apply it to patients in the real world. And I just have to say, we're real fortunate in the city of Henderson. Our training center is state-of-the-art. It is the nicest in Southern Nevada. So you get a chance to train and learn in not only one of the best environments, but probably one of the greatest cities. So
it's fantastic. So every single firefighter is also trained as an EMT?
Yes, sir. What we pride ourselves in Henderson is that we understand that the primary work that we're going to do in our community is emergency medicine. We have always embraced that responsibility as a part of all of the specific responsibilities that we've been given from our citizens. Just to give you an idea of that, 75% of the calls that we run every year are medically based calls. So we know that we're going to run those calls, so we really focus on being very, very good at the medical side of our responsibility. So even to enter in or even apply to our service, you have to have the basic level of emergency medical technician. And then from there, we train our personnel to get at the higher levels of the EMT training.
Wow, that's really comprehensive services and training. I never knew that coming into today, that every firefighter is also trained as an EMT. I mean, that's really fantastic.
Another thing
that you're offering.
Yeah, another thing we like to mention is every single unit that runs down the road in the city of Henderson is advanced life support capable. What that means is they have a paramedic on every engine, truck company, every rescue, so that every unit that we run in Henderson, at the Henderson Fire Department, can do complete at the highest level of service in the medical side of the equation.
It's very, very impressive. We also may have some listeners who have never even considered maybe becoming a firefighter. Maybe if either of you or both of you want to share the story of how you came to the decision that you wanted to dedicate your life to service, specifically within the fire department.
Start?
Sure. My father served as a police officer for the Metropolitan Police Department for 24 years, and as I was growing up, I knew what I wanted to be. I wanted to be like my dad. I wanted to be a police officer. And when I turned 16, I picked up an application for Metro's cadet process, and it was a part-time job application you can start to learn police duties. And I brought it home, and I showed it to my dad, and he was so excited. He said, "Wow, that's great. Let's go to lunch and talk about this and really talk about your future." And as we were driving to lunch, he made an unexpected turn, and he actually pulled into the parking lot of, at the time, what was Fire Station 91. It's Fire Station 81 now. He pulled into the parking lot, and I didn't know what we were doing there, and he went to the door and knocked on the door, and he introduced me to a firefighter, and he says, "Tim, this is my son Scott. He can come home again when he doesn't want to be a cop anymore." And so he introduced me to Tim McKeever. And Tim McKeever, I'm fortunate to say, he's our other deputy fire chief. I now get the privilege of working with him as my partner. But at that day, Tim told me about why he loved the fire service and what it was like, and I never looked back from there. Very next day, I enrolled in EMT class when I was in high school and became an EMT and knew I wanted to be a firefighter for Henderson.
Wow, that's wonderful. Chief White?
Yeah, what I always love about the fire service is everybody's story and path to the fire service is so unique, and I wish I had as great a story as Scott does, but it's a great story nonetheless. At the time I was young, and I never grew up wanting to be in the fire service, and even thinking about that as a long-term career choice. I was young and married, had a kid on the way. My wife and I were entrepreneurial. We started a business. We were doing well for ourselves, and had a buddy who said, "Hey, you ever thought about the fire department?" I said, "Hey, I looked at the fire department. What a great job. You only work, 10 days a week, and you have 20 days off. Great thing to run my business and be entrepreneurial." And so I was lucky enough to apply and get accepted into the Albuquerque Fire Department. The plan was always that we were going to build our business and be, millionaires building businesses all over New Mexico. And within a few years, just fell in love with the mission of the fire service, and just really felt the purpose in what I did a lot more than just making money. So the funny story is, I always thought I was quit the fire department sometime and continue to be a business owner, and it was just the opposite. I quit. We sold our business, and I became a lifetime firefighter. So.
We're all feel very lucky and blessed that you made that decision, because the accreditations and numerous accomplishments you and your department have been able to accomplish under your leadership is something that is a shining star for not just the city of Henderson, but the entire state. And you really, as a department, lead by setting the example for what other fire departments, how they should operate and function. And I think along those lines, there's a lot of really great initiatives that you've undertaken through the department. Maybe if you want to start off by giving us a general overview of services that the fire department provides to the community, and also if you could touch on the See Something, Say Something, Do Something initiative that the fire department has taken on.
Yeah, absolutely, Warren. First of all, very proud of, as you mentioned, we have worked very intentionally, very hard at creating a culture of excellence in the city of Henderson, and really looking outward as well as inward at what we can always do to improve ourselves and improve the services that we have. Very proud of the fact that we consistently outperform all the national standards when it comes to the critical calls like cardiac arrest, stroke, significant trauma, fire structure response, those kind of things. And we've created, like I said, a culture where we're constantly looking to improve ourselves. Who's doing it best? Don't be prideful. There might be somebody out there who has a better idea. Would that work in our community? And bring it back and build upon that. So that's kind of how we've grown up through the fire service. We're also very proud of the fact that we're the only full-service fire department in Southern Nevada. We run everything. We are responsible for full structure fire response, all fire response in the city of Henderson, as well as we own and run the emergency medical services, which is unique to communities. A lot of communities contract that service out to private agencies. We run the 911 service in the city of Henderson. We do have a private partner to do interfacility transfers that is a great partner for us. But the 911 service is Henderson Fire. And we love it, and we own that, and we take great pride in the fact that we serve our citizens from the point of contact all the way to the hospital and transfer to more definitive care. Also, we are responsible for hazardous material response in the whole southern valley of the Las Vegas Valley. There's only two hazardous material response teams in the valley, and we're one of them. So if you can imagine, the valley is divided in half, basically at Flamingo. And our partners in Las Vegas Fire and Rescue run the northern side, or respond to the northern side. We respond to the southern side. We also have one of the few technical rescue teams in the valley. So technical rescue are some very specific disciplines in our organization, or in the fire service, where you have to have extensive training. So say, for example, our technical rescue team is about to train on how you're going to perform rescues on the link, on the high roller. Now that's a problem, right? If that thing gets stuck, you're 550 feet in the air, so you have to have some different skills to rescue people from those types of incidents. So we have a team that specializes in high angle rescue, trench rescue, confined space rescue, and all those things. As well as we continue to become all hazards in the fire service, because the fact of the matter is this, is that outside of law enforcement criminal activity, if somebody has a problem that goes beyond their ability to manage, they're going to call us, and we're going to have to start figuring it out. So now, over the last few years, we've taken on new responsibility of search and rescue in our community, because our Parks and Recreation Department has done a phenomenal job building trails throughout the mountains around our community. But sometimes people go out onto those trails and are not quite prepared, and they get themselves into trouble. So we've had to learn the hard way. At first, we didn't really know what we're doing. We said, you know what, this is happening a lot during the spring, summer, and fall. So now we have 4 different vehicles that are prepared for that, and several stations that have that specific training. So wide variety of things that we're responsible for in our community. Excited to provide that for our citizens. I'm glad you asked about the See, Say, Do initiative. This is an initiative that was spearheaded by our current mayor, Mayor March, as we were looking at, the city's goal is always to be America's premier community. And we know as public safety professionals that you can't have America's premier community if you don't have America's premier public safety. And that means you have to have America's premier fire department. So how do we do that? And like I said, let's take, for example, cardiac arrest survivability. The Henderson Fire Department typically consistently runs 3 to 4 times the national average of survivability of this very critical, time-sensitive call. And what we've done is we've broken down that critical call into its different segments and said, how do we intervene and build upon our success? If we're 3 times the national average, why aren't we 4? Why aren't we 5? How do we get there? And what's very exciting to us is over the last few years, the science has shown with just some basic training and some early intervention, you can increase the outcomes, the positive outcomes with patients in those critical calls by 3 and 4 times. One of the things that's really exciting is if you'll just do compressions, you have a 3 more times chance to survive that incident than you do if you don't get early compressions. So with some of this new science coming out, we're working with the city on how do we engage the citizenry more? How do we get them to understand that you can be part of the solution if you're willing to do something? Now, the See Something, Say Something initiative, I don't know if you remember, back just after 9/11, that was a Homeland Security initiative, and we've just kind of built upon that. Say, do something, be part of the solution. And we feel like a lot of our citizens in our community are willing to do things, because we also believe that most human beings have the inherent will to help somebody in need, but they don't know what to do. So our philosophy is let's give our community some basic training so that if they're willing, maybe they can do some of these procedures as a bystander prior to our arrival. Because the truth of the matter is that we've got a great track record of positive outcomes if we can get our crews to a viable patient. So the question to us is always, how do we create more viable patients? So if they get some basic information, and the See Something, Say Something, Do Something is that initiative to get more people trained on hands-only CPR, stop the bleed training, those types of things. As we know through the 1 October event, if you can just stop people from significant bleeding, you can save a lot of lives. So that's another initiative. Providing this training for free. The next training session that we have is on April the 27th at 8 a.m. at the training center. You can sign up through our Parks and Recreation site, Henderson Happenings, online. Please come, get some training. Help us save more lives, because you can. I know it's a long answer, but I'm very passionate about this initiative, and we know we can save more lives if we get a little help.
This is a fantastic program, and to see the integration of science, response time, helping to keep a viable patient. I mean, those things are, I think, really eye-opening for me and the listeners. If the listeners, you gave the website. If we have listeners who want to call up and get some information, how they can get more involved or take advantage of some of these free trainings, is there a phone number that they could call?
There is. So it's 702-267-2222. That's our fire administration. And for any of these things we're talking about, we would love for them to reach out to us. That's a do something. And so like the chief said, we're always looking for ways that we can provide value to our citizens. We wouldn't exist without them. We know, and the chief says it all the time, we know why we exist, and we exist for one purpose, and it's because people matter in our community. And our job is to protect their lives and livelihoods, and more importantly, the relationships between those people. And so this See, Say, Do fits right in with our philosophy, because we know that the citizens will do something if they know what to do. And so we created that umbrella as the See, Say, Do program, and under it, we have a bunch of initiatives that are free that we want to give to the citizens that they can choose to do what fits for them. And so, if you don't mind, we'd love to talk about a couple things that are under there.
Oh, fantastic. We'd love to hear about it. One of the items that I was really interested to learn about in our conversations before the show was that you're integrating both science, outcome data, and also you're now integrating technology, I think, into some of your ambulance services. And it's something that, again, goes right out to the community and our neighbors so they could have better access. So if you could maybe talk a little bit about it, I believe it's the SMART program.
So we have two programs that under the CSA do, and they both go together. So the first one's the technology piece, and that's called the PulsePoint app. And PulsePoint is a company that several years ago said, how can we get citizen responders notified of an emergency so they can do CPR and maybe use an AED? And that's PulsePoint. And so the City of Henderson Fire Department, we are now one of the PulsePoint fire departments, and all the citizen has to do is download PulsePoint. The PulsePoint application is available on all of the app platforms, so it doesn't matter what type of smartphone you have. Choose the Henderson Fire Department and choose CPR alerts. And what the PulsePoint app will do is if you're near a cardiac arrest, it'll alert you on your phone. It'll immediately show you where the cardiac arrest is at and where the closest AED is. And if you go and provide that and you use the AED and you do CPR, that's one of those things that will extend viability for us, because we know that a person getting CPR, their chance of survival increases more than 3 times. And if we use an AED before we get there, their chance of survival is almost 7 times greater. And so PulsePoint's one of them. But we also wanted to do something that would provide peace of mind to people when they do have an emergency, and that's our SMART program. And the SMART program is a voluntary program that you can sign you and your family up for that really provides that last peace of mind in an emergency. And like the chief said, we're fortunate. We run the EMS system. So if you have a medical or trauma event in the city of Henderson and you call 911, the Henderson Fire Department is going to be there. We're going to take care of you, and we're going to take you to the hospital. And that's scary. And that does create a lot of concerns, but life still goes on. And part of that life that still goes on are hospital bills and ambulance bills and insurance and all of those things that makes life difficult. SMART program is designed to eliminate that. So if you're a member of this SMART program, for one low yearly cost, if Henderson Fire Department transports you or your family, there's no co-payment or co-insurance if you have insurance. And if you don't have insurance, it's an automatic 20% reduction on the bill. And a common question that gets asked is you're the fire department, I thought, taxes paid for that. And they do. They pay for the infrastructure for us to be there 24 hours a day, 7 days a week to respond. And we are going to respond to every call. And if we don't take you to the hospital, there's no charge. But if you take an ambulance in anywhere in this valley, you're going to get the same bill. All of the ambulance bills, fire department, private ambulance, it's the same. And they're pretty expensive. And so a 20% reduction is significant even if you don't have insurance. More importantly, though, SMART program automatically gets all covered members a full CPR certification course. And if you're a coach or a teacher, or if you need it for your job, finding a CPR class is difficult. It can be upwards of $200 a person to get CPR certified. This is included in your SMART program for all covered members. And we wanted it to be real cost effective so that we could reach as many citizens if that's something that's right for them. If this is something they want to do to provide peace of mind, you're going to have peace of mind in an emergency for your family, and you're going to come get CPR training, stop the bleed training from some of the best providers of medicine care in the country, we believe. That's the Henderson Fire Department. So those are two initiatives that were just examples of the do part under the CSA do.
That's a fantastic program. What are the costs of the SMART program?
So for the yearly cost for a single person is $59. That $59, if you have insurance, covers 2 medically necessary transports in a year, as well as a CPR certification Stop the Bleed class. It gets better, though. If you're a family, up to 6 people, you plus 5 of your family members in the same residence are all covered with those same benefits for only $99 a year. And if you're a very large family all in the same residence, it's $99, which will cover the first 6 residents, plus $10 extra per member after that. And so for my family, I have a family of 4, and even though we work for the fire department, we'll get an ambulance bill if our ambulance takes us. And we have very good insurance through the city, and even with that, it's going to be $200 plus. My $99, and I am a member, covers me and my family, all 4 of them, and I do have that peace of mind. 1, knowing I'm going to be treated by the Henderson Fire Department, and 2, I won't have to worry about those financial bills.
Oh, that's fantastic. And I think one of the things that you hit on before is that you're running the ambulance service.
That's correct.
Usually in other areas, it's contracted out to a third-party provider. So I think when people get confused about, do my taxes cover it, actually, people in other areas, their taxes don't cover it. They're dealing with a third-party provider. They're not dealing necessarily with folks who are getting as extensive and comprehensive training as your department and the city is providing to the folks who are working the EMS system for the fire department. So you're getting a comprehensive service, and you're also giving people an opportunity to be proactive in case of an emergency and to plan for it by signing up for the SMART program. Not only are they getting the discounted or free transports if they have the insurance, but they're also getting other proactive trainings like the CPR, which can help prolong life for parents, for children, for elderly. So I think it's a phenomenal program. And when you look at the cost of the ambulance transport, the $59 for an individual, $99 for most families, and for larger families a little bit more. It's a very, very inexpensive service.
No-brainer at that point.
And I don't know if you know this stat off the top of your head. I didn't ask you to prepare for it, but
It's okay.
On average, how many transports does a household in the city get?
Yeah, so last year we did over 25,000 EMS transports in the city of Henderson. And in communities that do have programs like this, they do know that a significant portion of that population is going to use it. And it could be up to 10 to 15% of subscribed members in a year will use the benefit. And that's important to us because, again, we want to make sure that the citizens have a choice in what they do something. And if SMART is right for them and it makes sense, we wanted to offer something to them that they would be able to do. Now, just to clarify, Pulse Point is free. We want people to do Pulse Point. Our training classes that we're doing for just regular CPR and Stop the Bleed, which aren't certification, those are free. We want to make sure the city, that the citizens in the city get that training. And what SMART program is going to do is it allows us to do those trainings. So SMART is reinvested in so we can provide those trainings for free, so we can purchase more AEDs and put them in public locations like all of our parks, etc. So SMART program helps us reinvest in the community.
It's fantastic work, and it sounds like if you sign up for the SMART program, pretty much for most households, your ambulance co-payments and so forth will be covered.
That's correct.
Because based on those numbers, most households don't reach those numbers. But if you do reach it, you're going to save yourself a lot of money that year. This has been unbelievably informative. I feel a lot more comfortable here, specifically in Henderson.
Good.
Because I know that emergencies are being responded to. I know it's being done comprehensively. I know that there's not multiple parties, that there has to be a handoff for information and communication. It's all being done within your department. It's so innovative. It's really a tremendous service to the community. And I want to applaud you for the wonderful response time, the quick response that you're doing, the comprehensive services you're providing directly to the residents of Henderson, and all these proactive measures that you're doing to provide community education, community response, and engage everyone, because we're all part of the solution to make sure that people in our community get the best health response possible, best fire response possible. And it really is a pleasure to have two distinguished leaders in our community, such as you, Chief White, and you, Deputy Chief Vivier. The information is very informative, and I know our listeners have all learned a lot today. I know I have.
Thank you, Warren. We really appreciate you having us.
Yeah, thank you, Warren.
I also want to give a big thank you to our sponsor of Healthcare Sunday, which is sponsored by TrueCare Treatment Centers. If you or a loved one have an addiction or mental health issue and need care, they not only provide free transportation, but they provide psychiatric services, but done by a psychiatrist, therapy services, and addiction medicine, as well as addiction counseling services. If you need help, you can reach them at their 24/7 hotline at 1-833-203-2848. That's 1-833-203-2848.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers.